So, okay, now we'll go back. So, sorry, I'm dressed like this. I'm doing a kids vaccine clinic, and so I don't scare them. I dress up for the holidays. Okay. Now, can you guys see it again? Sorry about
Yes.
that disruption. Go ahead, Lizette.
Yes, so but correct me if I'm wrong, like, yes, so I would just recognize that and engage with them by listening to him, listening to Antonio, his wording, and then the way I would assist him is by, like you said, listening, and then also making him feel seen.
Yeah. I think you did a good job about solutioning, because one of the things when people want to end it, they see no way out. So I think offering to help with the resume or doing some things like that would help. Does anyone else have anything else to add before I tell you what happened and what the recommendations are? Go ahead. Anyone else?
This is Thelma. I think what I might do, I love everything Lizette said. And depending on my relationship with him, but I would also get clarification, so I'm not assuming. I know what I think when a person says they're going to leave this planet, but in a gentle way, with listening again to everything he said. Can you clarify, like, what you meant by leave the planet? So I can keep us on one page. I don't want to assume, even though I know what I think. And then again, I would might ask, what are your immediate needs? So maybe I am able to identify some resources for you.
Yeah, I think, what is your immediate need? And in this scenario, when you get clarification, you might end up doing what Lizette referenced earlier, which is using that 988 to get him help if he really is thinking of leaving the planet, because you don't know when he's going to do it. And as you know, people usually plan, contrary to popular belief, they plan to when they're going to leave the planet. So they control that. So those are very good that's very good feedback. I think both of you pretty much nailed it. The one thing I will tell you, what really happened in this scenario, and this is like straight from the headlines, this happened recently, about a week ago, and the family did not acknowledge his comment about leaving the planet. And so he actually did leave the planet, unfortunately. And they look back and they wish they had taken him seriously. And they knew that he was being laid off, but they didn't realize how he had taken it. And there's another sad part to the story with what he did to his wife, but we won't talk about that because this is about the individual first. So it's a red flag, I think Lizette said. When somebody says that, take it seriously. So the family is really trying to promote people calling 988, listening and paying attention, because this has been a disaster for them. And they feel really badly because she was in healthcare and she didn't see it coming because she was really busy too. But nobody is to blame. A person takes action and it is what it is. So thank you all for that. So this is straight from the headlines. It really did happen. Okay.
Yeah. That was heartbreaking. What was I going to say? Like you said, like, just, I think this reminded me, like, it always reminds me, like, the power of words. I think we take it for granted, but words have so much power, like to empower you or to like destroy you. So yeah.
Yeah. And they said he was the most unlikeliest person they thought would do this, which happens a lot when people think folks who are at a certain level have it all together, and he pretty much did not. He fell apart, but he didn't demonstrate falling apart other than that comment that he had, and nobody noticed it. So that's one of those, you can't regret what you can't do. What you didn't do is just more moving forward. Any other comment? Somebody was going to say.
I do have a comment. My other comment to that, okay, that being a male, do you think sometimes with situations like this happen, similar men, because I understand statistically more men commit suicide than women. Is that still true?
Yeah, and during this time, women are catching up to men during the pandemic time, but yes.
Because I was, go on, I'm sorry.
No, that's a differentiator now. The volume is so high now, it might match. So unfortunately, the volume is up a lot. there's been a significant increase in women doing it and younger people doing it.
That's interesting because I was just thinking, okay, by him being, you know, the man of the house, sometimes men stress out more because they're less likely to ask for help or resources or go to mama and papa, where a woman might say, you know, if she has family members or a mother, she might say, well, worst case scenario, you know, we got to fold this place up and move in with mom.
Yeah,
I mean, there's different things, or
sure.
you know, that women might do. I know
Yeah.
I would do, and you
Yeah.
know, I've been
Well,
in some bad tight spots where job loss caused you to wonder how you're gonna, you know, hold it together. But I don't, you know, sometimes women are more likely to go to their sister, mother, auntie, and
yeah, normally, but right now
Yeah.
during the pandemic,
Yeah.
with the great equalizer has happened. So it's just random on who's going to do it. And Fabiola, I believe you had your hand raised. Go ahead.
Yes, I just I had more of a question
Uh-huh.
pertaining to what Thelma just asked about, you know, men committing suicide more, because I had taken a training several years ago, and I recall there being some kind of I think it was saying that the number of men, they're more successful
Yes,
at
women attempt, but
actually
men succeed.
yeah, right. The
Yes.
women attempt more, but the men succeed. So I don't know that it's so much there's a higher number of men committing, attempting, but I don't know, maybe I'm saying it wrong, but I know that it was like that they
Yes.
have a tendency to be more successful at completing the act, whereas women are not.
Yeah, the reason to a certain extent right now is because of guns. Men tend to use guns more than women. And right now, the most common, one of the most common ways is gun violence.
Okay.
So that's part of the reason why men tend to be more successful. They tend to use guns more than women. Women may use medication and it's able to be pumped out of their stomach, which is sad to say. So two people have raised their hand, and Marquis, I can't see who they are. So go ahead, whoever raised their hand first. Not sure.
It's just me. I think Fabiola still has her hand
Oh,
raised.
okay. Okay.
That's an interesting
I
fact.
lowered
I just got to, thank you. It's an interesting fact about the men who actually go through with it and the women who attempt it. I didn't know that.
Yeah,
Thank you for that.
yeah. Particularly when we think celebrities, one of the things men are planners like women when it comes to suicide, but they plan more specifically on making sure it's closure, which is very interesting. And this individual did leave a note behind. So he was very specific about his why. That's why we know it was because of, and what he said before, you know, he decided to do it. Okay. So some of this is sad, but it's a lesson kind of thing. So it's what it is. So let me go to the second one, which is something that happened as a youth situation. Keisha, who's a teenager, she's a Black female. She was at a school clinic, and you noticed some small cuts on her arm when you were getting ready to administer the vaccine, or you were helping someone who was going to administer the vaccine. And you noticed some of the cuts seemed recent. She seems withdrawn and she avoids eye contact, except for the fact that she lets you know that she's not afraid of blood. For some reason, that's the only thing she did say, and she still didn't make eye contact. So I'll pause there and let anyone who wants to take this one take it, because the cuts were alarming to the person and the support person who was helping them at the vaccine clinic. And we'll talk about what do you do if that happens. And this could be anywhere. It just happened to be at a vaccine clinic. I've heard of people seeing this in the home or, you know, with younger people. Traditionally, it seems to be more females that are doing this particular type of self-harm, but it's prevalent in adolescents. So anybody want to take a shot at this one? There is no right or wrong answer. Just try to follow the model is all I can tell you.
I'll take a shot at it.
Okay.
So number one, I think to recognize, which is something, I don't know, I feel like all people who work in public service, they can identify like different types of body behaviors.
Mm-hmm.
You know, whether somebody's withdrawn or whether they're angry, upset, really happy.
Mm-hmm.
So I think that's one thing, just to recognize the body language, and then maybe ask, hey, what's going on with you today? Or open-ended question
Mm-hmm.
to see if you can kind of get that person to engage.
Mm-hmm.
Which brings me to the second point, which I would just kind of ask, you know, like, what's going on? What are you doing today?
Mm-hmm.
You know, what's been going on in your life today? And just kind of listen.
Yes.
And then if I can get them to open up, which to me, this situation, this person,
Mm-hmm.
would not be likely to open up so easily, especially to a stranger.
Mm-hmm.
So I would, for assist, I would just, you know, ask if there's anything I can do to help you, depending on the information I gain. If I feel like there is a suspicion of self-harm,
Mm-hmm.
that sort of thing, then I would just provide a phone number and maybe some comforting words to the person, and then I would just probably follow up with if that was if is it a kid? I forget. Yeah, it is.
A
I'll follow with
teenager.
the school, or the parent, let them know
Great.
what I identified in my concern, and then I would just leave it with that.
Yeah, I think that's excellent because you don't know, but the one thing you have to be careful of with adolescents is trying to draw them out to give you information. So your approach of doing it in a non-threatening way and kind of trying to get that person to talk. But even if they do talk, or if they don't, notifying some other people that this is happening. Because it could be two things. Somebody could be doing it to this person, but more than likely it is the person doing it to themselves. So the truth is this person was cutting themselves, and the person was able to get intervention because somebody noticed and got them help from the school and let the parents know. So that I think you nailed it in terms of what you do next, because you know we're not therapists or whatever. So Tatiana, go ahead.
Yeah, I just wanted to ask, or I mean, maybe to add that if we're, say, administering vaccines, right? So we're probably the RN, so we need to tell them also. So whatever they tell us, we'll have to disclose that information.
Yes.
To, yeah, so I think it's important for them to know. So if they want to share, we will not, that there's a chance that we're going to disclose that the information
Yes.
they share.
Because you're a mandated reporter.
Right.
Right. And I think that's okay. And what was interesting in this situation, it was almost like the person who intervened did exactly what you said, because she was really concerned that this person, given the number of cuts she saw, she was concerned that this had been going on for a while. And even though she let that kid know, the kid was fine that she got her help. Maybe this is what needed to happen because this had been going on for a while and no one else had seen her arms or anything. So you're absolutely right. And this person Keisha actually engaged with the school nurse and some other people once the vaccinator told them what was happening. So maybe that was her way. So thank you for that. So that is the right approach. Okay.
Thank you.
It's a strange one, but it does happen. And even if it doesn't happen at a vaccine clinic, one of the giveaways for this person was when they interviewed the parents. She had been wearing, and it was like hot outside. She was wearing fully long sleeves. And at one point she was wearing a turtleneck. So she was hiding it. And they didn't notice, but it was really hot outside. So that should have been a cue, but they did not notice her clothing because it says she always dressed baggy and things like that. So that would have been a flag. So those are just some of the cues that the parents say they totally miss. Okay. So let's go to this last one. And I think it refers back to what Lizette talked about earlier, which is caregiver situations. So you have a coworker. Her name is Rita, and she's a caregiver for a parent that has Alzheimer's. She's been late and missing work suddenly and sporadically. She also has complained of exhaustion to the point she has bags under her eyes when you've seen her, and she's very frustrated. She's also expressed concern about how much it's costing her, not just work and stuff, but financially to have taken on her parent and have that parent move in with her. So these are some things that are happening with the caregiver. And right now she's just tired and frustrated and having a hard time managing this new situation where she's taken the parent into her home. And she's a single person having to do this without a lot of help. So I'll pause there and see if anyone has any feedback on how to approach this one. Anybody want to take a shot at it? And remember, there's no right or wrong answers. These are just for training purposes, but this stuff really happened and it's pretty recent. Okay.
I can
Oh,
try and
okay,
take a shot at it.
sure.
I going through, I think, one of the first things would be to kind of find a non-work setting to like invite them to have a conversation, outside of work or
Mhm,
after work or something that isn't in, a professional space.
sure.
And then kind of offer support and engage by, asking them, telling them that they can open up, telling them that, that you would understand that it must be, a stressful situation, offer
Mhm,
to assist, depending, like Ms. Thelma said, depending my closeness to the person,
mhm,
offering to either assist in the
mhm,
way of, offering physical support or offering, if you're less close, emotional support, and saying,
mhm,
that you're somebody to talk to, and just kind of allowing them a space to express their frustrations while also offering potential,
mhm.
solutions, and just letting them know that, you acknowledge that that must be a very stressful thing to take on and that they don't
Great.
have to kind of go through those stresses alone.
Yeah, that's great. So the acknowledgement is really important. And what really happened here is a person did go and meet with this person at their home, the coworker did, and she basically stepped outside and was just devastatedly crying. And that was like a relief. And she gave her a resource, which was a caregiver support group and a couple of other resources that I'll show you all on the back end that you may or may not be aware of, not just a support group, but some other resources that Rita was not aware of that existed because she took this on suddenly and didn't even have time to really prepare for it. Okay. So good job with that one. Okay. So let's go to something that's really important, which is the mental health resources, because someone said, how am I going to remember all of this stuff? Well, if you can remember one thing, remember to go to the Mental Health America site. And why that site is so critical is because it's got everything in the kitchen sink. There are different sites for different conditions, but this one has training support. Like if you forgot what we talked about, it tells you how to start a conversation with someone about their mental health. It has a link that allows you to find out everything from postpartum depression to any type of anxiety, online screening for different mental health conditions. Although we don't necessarily recommend that, it is a tool that a lot of the young people find useful. It also tells you about apps that are available since some people are really into the mental health apps. It also tells you what to do and some support resources for crisis, self-harm, and suicide. And then there's things called warm lines, which is if you really need to talk to someone, like I was telling you all, I had gotten on the phone call and triage with getting this person on the phone with someone. And this is that warm line that helps. And they stayed on the phone for this person for about an hour and a half until they could get them resources. And they also sent and dispatched a welfare check for this particular individual that I was dealing with. And all of these resources are also here in Spanish. So that's why this one is an easier one to navigate. And there's all kind of guidance about what to do. And then there's like the crisis line where you can even text. You don't have to necessarily pick up the phone. And the reason why I bring this up is because sometimes you can't be on the phone when you're dealing with someone, but it's easier to kind of do a text. Instead of trying to call while you're dealing with someone. So that's why the text line gets a lot of messages as well. So this is like a one-stop shop. It's the easiest one to remember. But remember, I sent this out to you all, but you'll also get this recording. So the Mental Health America is one of the easiest resources to remember. The next one, sadly, is the suicide prevention one. The 988 is the top number right now that's being used. But again, there's a text right here that you can use and they will immediately respond. And locally, the Los Angeles County Department of Mental Health has quite a few resources, and they have a coalition of people called the Los Angeles County Suicide Prevention Network. And they do a lot of training. They do give continuing education credits in some cases. So this is their little logo. It looks like they call it hero symbol, but they do a lot of different things, and they have a lot of toolkits and stuff like that locally. So I'm providing this. This is the same number. We are all using the same number for everything, except for the fact that LA County Department of Mental Health has its own line. And if you want something local, that's what it is. But you don't have to remember any of this other than if somebody needs help, that 988 or texting is easiest, okay? The next one is substance abuse, the Substance Abuse and Mental Health Services Administration. This is a very popular one, and it's kind of best in class. They also do training. They do have telephone-based support for mental health abuse. When I was over one of the mental health hospitals, we did a lot of support groups that they promoted, and SAMHSA has a national listing by city, by zip code, by demographic of different support groups. And also this disaster distress helpline, I ended up using it a lot when we had an earthquake, Northridge earthquake, and I worked at Northridge Hospital. Also used it more recently where people had flooding in the southern states, because people have a lot of emotional distress and they don't know what to do. So there is a disaster distress helpline that also helps people in crisis, and they help comprehensively. My friends in New Orleans were also using this line quite a bit. And you can also apply for project funding. There's a lot of grants that are available through the organization, and there's a link to it right here. And there's also a lot of people are doing research. So there's a lot of community engagement, evidence-based practice resources. So you can also click the link and get that as well. Okay. And then the next one is one, I think somebody has something in the chat. So let me see what it is. Mental Health America. Oh, great. Okay. The other one that a lot of people aren't aware of is LA County has Free Headspace, the app that is very popular, and it allows you to do meditation and mindfulness. I'm sorry, what did you say? Okay. It allows you to do meditation and mindfulness. It's an application. You can just put it on your phone, and it's free for everybody in Los Angeles County, age 13 and up through February 2023. And it's got all kinds of things, and it teaches you how to do meditation, and it has things for sleep. It has exercises, has a lot of different things to improve stress. You can click this link. And what they've done in order to make sure is LA County residents, because it's one of the only states and counties that's doing this, is you'll have to be physically in LA. And the only way they know that is you go in and you create a free account, and it automatically sees where your location is. And it just does that temporarily so that they can verify your eligibility, because so many people from other states were trying to get into this that they limited to LA County residents, and it's supported by the Department of Mental Health. And it's only if people already don't have a subscription to Headspace, but we want to make sure that, we want to make sure that you know that it's not in place of any type of support or counseling. It's really just to augment, and it's meant to be a source of strength, not to replace any kind of intervention. So we still say, please go and get resource help. But this is just something that may help you. I've been doing the Headspace, learning how to do it. So it's a good thing. So someone raised their hand or have a comment? Marquis, did you?
Hello, that was me. I had a question about the last slide.
The SAMHSA?
Yes. That you said that resource on the bottom, the center. Is that only for mental health resources, like as far as funding?
The grants are for related to anything that's substance abuse related. Okay. So that's what the grants are for. And there's so many of them, I couldn't even tell you where to start. One of the hospitals I had, they used it for special caregiver support groups. Some used it to get a cell phone program for certain types of people. So they got free cell phones and they could text for help and check in through their cell phones. So different types of programs depends on the project you're interested in. Does that help any or not?
Yeah, that's perfect. Thank you.
Yeah.
I was really just trying to focus on what it was mainly about, but I see it's about substance abuse, anything
Yeah.
around substance abuse. Okay.
Yeah, because what they want to do is a lot of the substance abuse is self-medication. So they want to do interventions that are mental health interventions, because most of the times there's deep-rooted mental health reasons why the substance abuse is so pervasive. Does that help?
Yes, got it. Thank you.
And the disaster distress helpline is to prevent people who may go towards drugs or were in recovery, but it can be used for anyone. It's not just for substance abuse. It's for anyone. Okay.
This is Jerry, and I have a question, Doctor.
Mm-hmm.
These hotlines, or where you call in for help,
Mm-hmm.
are they multi-language? Because
Yes.
maybe language might be a barrier for someone to try to reach out for help.
Yes, they are multi-language. At a minimum, everything was in English and Spanish, but they've added quite a few languages for almost all of them. And LA County has many languages for their site. So I can't tell you how many languages, but I know it's quite a lot, because I had somebody who needed Tagalog. I had somebody who needed 2 different Chinese dialects, and they were able to help them. So I guess it varies, but they're able to, it's 24/7, but they seem to have all the languages that I've ever had to refer people for. They've been able to handle it.
Okay, thank you.
But it's a good question, because I haven't looked in a year or so to see what languages. So I'll follow up and see, okay?
Thank you.
Good question. And then another one is mental health resources for caregivers. Alzheimer's Association has quite a bit, but there's also, and you may know this, as in-home supportive services. It has an acronym, IHSS. A lot of people, like this case study we saw, they are adversely impacted financially by doing caregiving. So there is a state of California program where you have to go and fill out paperwork, and families are able to get funding to help support their caregiving efforts for a person that's either over 65 or that is a disabled kid. So it's not just for seniors or people with Alzheimer's, it's for all kinds of caregiving. You can click that link and go to the site and see what it entails. I just recently had someone who was trying to fill out the paperwork and needed help, and they got help to complete it and were able to get funding to help support taking in their grandfather. So it does seem to work in California, and it's for low income. It's not like anybody can just get it. So there are some requirements, but you can click the link and find out, okay? The other thing that's unique in California is caregiver resource centers. They're across the state, and they do help people with that are caregivers for people with all kinds of disorders or mental health situations. And California was the first state that really did this, and they have an extensive caregiver resource center network. However, you have to click the link and see what's local to you, because I can't say that they are in the right places across the state. So you'd have to, find out if there are some that are in certain parts of South LA in different areas. But some people who've used them told me they were extremely helpful for them. And there's also a web resource guide that has all kinds of resources for caregiving. Things like if you have to put railing in, on the driveway or in the bathroom, things like that, all kinds of resources, whether it's medical information, foundation, support group, where people can get some, at times there's financial support resources, and also special types of doctors or psychologists or psychiatrists that deal with certain conditions. They're experts in geriatric care or certain types of care. So the web resource guide is really helpful. And then the Administration on Aging, Families Caregiver Support, they have a lot of support for caregivers, so that's a resource. And then this last one, which is helpful, is a National Respite Locator Service, because some people are doing this caregiving around the clock and at times need relief. I know one woman called us because she needed, she had to go to a funeral and there was no one she could get to help with her parent. That was the Alzheimer's person. So we were able to triage her request. And what we found out in her case, her mom had Scan Health Plan, and they actually provided respite care as part of the plan benefit for the Medicare Advantage members. So she didn't even realize that. So the respite locator services is pretty comprehensive. Some of it costs, some of it does not. So it's really a resource to try to figure out what can be done to match a need when a person needs some relief. In one case, we had a person had to go in the hospital and there was no one to take care of the person who needed the help at home. Okay. Any questions or comments about that? Is that very clear or not? Okay. Great. So hopefully you learned something. Go ahead.
That is clear.
Okay. Well, so hopefully you're learning something about different resources. And here's another one that you may not know about, or you might. It's the Historically Black Colleges and Universities. They have a special program that was put into place by the Substance Abuse and Mental Health Services Administration, specifically for historically Black colleges and universities. And so this, there's a Center for Excellence that is catering to historically Black colleges and university students. And they really are trying to make sure their programs align and are culturally appropriate for the constituent groups. And it's undergraduates that they're trying to not just expose them to careers, but also they have their own ambassador program to help engage other students, like peer counseling, in addition to hoping to influence people that may want a career in behavioral health or just want to be a peer counselor. This program allows for $7,000 stipend and also gives professional development for those who are interested in a career in or exploring a career in behavioral health. And it's only for 1 year, but it's a pretty comprehensive program. And some of the funding and support for this is also aligned to a celebrity, Taraj Henson. She has her own foundation and she helps support this one since she's a graduate of Howard University. She wanted to make sure she supported, programs that helped historically Black colleges and universities. So I'll pause there to see if there's any questions or comments about that one. And you may have already known about it, but it's some people don't know about it. So I want to make sure everybody knew. Okay. All right, well, I'll go to the last two. This one is mental health first aid. Originally, Reverend Danisha had talked to me and we were looking at mental health first aid training, but it takes at least a day. And if you're going to be a trained person, it takes 3 days to get the certification. And First Lady Michelle Obama, prior First Lady Michelle Obama actually took the training, and she was really glad that she did it and said that she wanted to make sure other people were aware of how it's really helpful. So you can click this link for information. They do have some scholarships and you get a certification and can actually charge if you want to be a trainer to put on this program. And the curriculum is all evidence-based. And also, I think Lady Gaga put funding into this for schools across the nation to help fund more people getting it. That's why there's some scholarships available. So they have it in categories. There's adult mental first aid, there's youth, and there's teen first aid. So they've specified the different cohorts of age groups. And like I said, it's 3 days to become an instructor, but 1 day full training. And it is virtual and in person to get, at least it was early in the pandemic. You may have to double check that. And again, there's funding opportunities too. So there's a link for that, whether it's funding to take the course or other types of funding related to this. Any questions or comment about that? Okay. Then the last one that I'll bring up is the California Department of Public Health. They have a mental health and wellness webinar that's open to all of you and anyone who's interested. It's a 60-minute webinar that they are scheduling on this specific day because this is the 2-year anniversary of being able to distribute the COVID-19 vaccinations. And they will have all kinds of best practices and information and subject matter experts. And if you're interested, you can register by clicking this link here. And I will send this out with the recording. So if you're interested, you can click, because this was not in the original presentation I distributed to you all, because I just realized that it was available. Okay. So I'm going to stop there and just tell you how grateful I am that you're interested in even being a mental health ambassador. It's not an easy thing to get engaged in. So I'm going to stop sharing my screen. And hopefully this was beneficial to you all. And it will help you, whether it's personal or professional, it should help you engage in mental health in a probably an easier way than just being intimidated by it, hopefully. So I'll pause there and see if there's any other comments or questions. Okay.
Just want to say thank you so much.
Sure.
Yeah, it's so much needed. So thank you.
Sure, sure. Okay. So
I'd like to say thank you also, Dr. Veal. This is excellent. Every session was wonderful, and it's given me some ideas so I can kind of expand what I'm doing with the opioid fentanyl thing, you know, how to incorporate a little mental health services in there. And the referrals are excellent. I'm going to put them on the slide, the PowerPoint that I created.
Great.
Yep.
Yeah. Anyone else? I did have one last thing, and I'll let Reverend Donisha have the floor. I did have one last thing that's helpful. I did training with some youth, and we watched some films. Certain movies resonated with them. So there's a few movies out right now. One is out on, there's Netflix, there's all of the streaming services. So there's a lot of mental health content now that could be helpful, as opposed to trying to explain to people, letting them see how some of the celebrities have engaged, and in some cases, they actually show their meltdown on screen so you can recognize some of the symptomology. So go ahead, Reverend D, I'm done.
First off, you look so cute.
Thank you. Yeah, my elf outfit.
Come on, Christmas plaid. Dr. Veal is such a fashionista, so I know I'm recorded, so I wanted that to be recorded in the minutes. How cute Dr. Veal looks today. Certainly let me say thank you. This information has been invaluable. I would even say that I received a call last week unrelated to the street medicine program, but I received a call last week for a family member, my own personal self, who was in mental health crisis. And the information that you shared was very useful in that scenario. But what it makes it most interesting is when the individuals themselves are also mental health clinicians. And so when mental health clinicians get in crisis, and then how do you respond to them? Because they're used to disseminating out the same information that you're receiving. But nevertheless, just the case studies and just the information. It's very, very helpful. Thank you to all of the team members who took time out these last 3 weeks to join this most important conversation. Mental health is always among us. It's something that we will personally deal with and professionally deal with our entire lives. And so I think knowing not only to recognize it when we're having crisis within ourselves, but also to recognize when we can respond to others, and then when we may need to step away so that we don't develop secondhand trauma and different things because we learn what our own triggers are. I think it's just so significantly important to the work that we're doing. So I know that you're more than likely 10 times out of 20 in a clinic, but took time away to come and to share with us and step away from that task to be with us. And we are tremendously grateful. The county is tremendously grateful. We are better 2 years later for COVID because of you, Dr. Veal. So I just want to say thank you so much for all that you do, seen and unseen, that you have just been an amazing gift to LA County in this season. So thank you so much.
Okay, well, onward and upward, and you guys will be out there doing great work as you continue forward, and have a great holiday season. I know it's a tough time for a lot of folks, but I appreciate everything you do as well. Okay, so I will be sending your email certificate, so you'll have my contact information if there's anything else I can support you with. Okay.
Thank you, Dr. Veal.
Thank you, Dr. Veal. Appreciate
Thank
you.
you. Thank you. Thank
All
you.
right, take
Thank you,
care.
Dr. Veal.
All right, happy holidays.
Happy holidays.
All righty.